This year we decided as a committee that we wanted to make this walk even more meaningful than it has been in the past. And we wanted to thank someone who has given a lot to people that suffer from arthritis. And so as a committee, we sat around the table and we thought about several people that we feel have really given to arthritis and to its patients. But while we were sitting there talking, there was only one doctor that came to mind for me, and that was Dr. Graf Radford.
Dr. Adrian Graf Radford comes from a family of physicians. The eldest of four and a native of Johannesburg, South Africa, he was influenced by medicine early in life, attending the University of Witwatersrand in Johannesburg, where he received his undergraduate and medical degrees. Dr. G.R. also served his internship in general surgery residency at the University of Witwatersrand Hospital, where he was a lecturer in the Department of Anatomy while completing 2 years of orthopedic residency. In 1976, a move to the United States started the first of a 4-year orthopedic residency at UCLA. Dr. Adrian Graf Radford joined Desert Orthopedic Center as a founding partner in 1980. Since then, he and his wife, Cass, have resided in the desert, raised 2 children, James and Vicky, and built an outstanding reputation both in his profession and the community.
When I started, he was certainly, his forte and main interest has always been total joint replacement. He did research at UCLA in joint replacement, and one year they wrote a paper on surface replacements and won the John Charnley Award, which is a very prestigious award from the Hip Society. You know, I think again, it was a very exciting time, and it's a very exciting time in orthopedics, a lot of rapid developments. I think back then they had a very, a young, good group that was, trading together, and I think they all were on the west side of LA in an exciting period, and they had fun and did a good job, and they have all made great strides in their career and good names.
I've known Dr. Graf Radford since 1980, and been very good friends with him for 27 years. Finally came to work for him in 1989 and was his private scrub for about 5 years, and then became the practice administrator in the group that he practices in now.
Oh, when I started here, there were only 4 doctors. Dr. Murphy, Dr. Lamb, Dr. Bush, and Dr. Graf Radford was the newest doctor at that time. Yeah, we were in the right building, and we only had space for 2 doctors to work, and the other 2 would be in surgery. They shared nurses. They didn't even have their own nurse at the time. They shared nurses or MAs. And at first I was afraid of Dr. Graf Radford, but then you got to know him, and he's a pussycat.
When I started at Desert Orthopedic Center, it was February 21st, and it was Dr. Graf Radford's birthday. And I walked in on Tuesday, and I thought I was going to have another x-ray tech there helping me. Well, they had fired her on a Friday, so I walked in, and I hadn't done x-ray for about 6 years. So I walked into this huge, situation, and Dr. Murphy and Dr. Graf Radford were in the office. So I'm doing x-rays, trying to figure out all of this, and so like the 3rd day of the week, Dr. Graf Radford called me up and he said, I really had doubts about you working here, but without having the experience for 6 or 7 years, and he said, but you're the best tech that I've seen. And ever since then, the relationship grew.
Yeah, I do work with Dr. Graf Radford under the most stressful conditions that I think any physician can work under, and that is during the time that a person will actually operate on another human being. I think to have the courage to, perform an operation on another person is one of the most courageous things that a doctor can do.
I could call him night and day for anything. If I was sick with anything or my family was sick, I could always call him. He's actually been like a part of my family for many years since I've been in the desert.
Really the best thing about working with him was just watching the people come in after they've been treated and how great they felt. We had patients who came in who needed total hips, and they're rock climbers, and they still do that. Maybe not at the doctor's, he might not want them to do that, but that's their passion in life.
In general, surgeons have the reputation of being pretty intense people, you know, and obviously there's different words to describe that, but
Yes. Dr. Graf Radford is quite a perfectionist.
As an employee, he challenged you.
Millie, my practice is going down the pot.
Yes, and he's been demanding on several occasions.
He's got a great sense of humor, you know. He can have his days, but
Yeah, he can be a little, yeah. Yeah, put the hammer down. Yeah, he can. He definitely can. He's never like that with me, of course.
in Dr. Graf Radford's case, I think it's most of the time it's worked for his advantage because he's a very intense, precise, demanding guy, but you know, he's always doing it for the interest of quality and the patient and to get the best job done.
But that, I think, is one of his strongest points, is being a perfectionist.
He felt that everybody brought something different to the table. And he respected that, whether it was a little knowledge or a lot of knowledge, and he expected that when you brought something to the table that you participated fully.
Okay, and I'd let him talk and I'd listen. So what do you want me to do? Do you want us to go to the mall and round up a few patients for you, or?
And so when he doesn't get his way or he doesn't see that this is perfection on his part, I agree with it. He demands it and he deserves it.
We have learned that those days that he can be so difficult to get along with, those are days that he is just really concerned about his patients, caring about his patients and whatnot, and you know, we don't not let that bother us.
He would not make promises, but make intentions, great intentions to the patients. And his job was to fully service those intentions.
Even though he expects perfection from everyone else working around him, his goal is for the patient.
You know, he does a perfect incision. He does he really does a perfect surgery. I mean, I can attest because he did surgery on me.
Dr. Graf Radford is who people go to see. If they want a hip replacement or a knee replacement, that's who they want. And they'll come from Canada, they'll come from all over the world.
My dad always said that integrity was not only shown by a man's character, but by his sincerity of action, and I think Dr. Graf Radford has a lot of integrity.
He just does miracle stuff.
We have a great relationship. He's a good friend. Yeah.
He always knows that he's taking care of a patient first, that he's caring about, you know, the patients first, putting human beings first. That's what his whole career has been dedicated towards, caring for patients.
When I was 18 months old, I was diagnosed with juvenile rheumatoid arthritis. And at that time, there just was not a lot of information or a lot of medicine to stop and control the disease. So I was on aspirin for approximately 8 to 9 years. As I got older and I graduated college, I went off to teach. And about 3 years into teaching, I started to have a lot of pain in my hips and knees. And my hips and knees started, as they say, locking up. I kept remembering what a doctor said when I was very young, and he told me that I would someday have to just put in my mind that I was going to be in a wheelchair. And I wasn't ready to hear that. I was 24 years old and I had so many things yet to do. So I made this appointment with Dr. Graf Radford. I pretty much in my mind had decided he was going to say, sorry, you know, we can fix it, but you're not going to get any more mobility. You'll probably lose it. That's what I went in thinking. And the minute that door opened to his office, I will never forget. It's just etched in my mind forever. I just became calm. And he came over and he introduced himself to me and he put up the x-rays and he said, well, we sure have a mess here. And I kind of laughed and he kind of laughed and he just put me at ease and he said, you know, you have a lot of bone on bone here. And I agreed. And he said, which ones hurt worse? And I said, my hips. And he said, well, I'm going to take away all of the pain that you have today. I had bilateral hip replacements 6 weeks apart. And the following summer, Dr. Graf Radford did bilateral knee replacements on me. And throughout that time during the surgeries, all I kept thinking is what he said, I'm going to take away your pain. And he never lied. Even the day after surgery, the pain was less than the day before surgery. And I knew this was a man that really changed my life. And he was sent to me, and I couldn't give up. So while I was doing all my physical therapy, he would always tell them, you know, to push me a little further in my physical therapy and try to get a little more degrees of motion. And I wanted to do it for him and for me, but really for him, because I knew this was his specialty, and I wanted to see how far I could push myself. And I just feel very grateful to him. And that's been so many years ago. And while I've had a lot of wonderful doctors, I can't even express to anyone what he's done to me and changed to me, because I wouldn't be here today as the arthritis walk chairperson. I wouldn't be able to walk in this event every year that I do if it wasn't for him. I feel like he saved me. He really saved me, and he helped me walk again and enjoy life again.